Saskatchewan is reporting 476 new cases of COVID and 7 new deaths just over the past 24 hours. And over the past 3 weeks, COVID hospitalizations and ICU admissions have doubled. Meanwhile, Alberta is looking to other provinces for ICU beds and staff as the situation becomes critical. The question, of course, in Saskatchewan is, are they going to be headed in the same direction soon? Let's ask Dr. Susan Shaw, who is the Chief Medical Officer of the Saskatchewan Heath Authority. She is in Saskatoon. Dr. Shaw, can I just start actually with Alberta for a moment? The situation's so dire there that they're shopping around and asking other provinces, A, can you take some of our patients? B, can you spare any of your medical staff because we are overwhelmed? Given the situation Saskatchewan finds itself in, is there any possibility that you'd be able to be a help to your neighbours?
Well, we were able to be a help to Manitoba in the third wave, but I don't think, sadly, we're in a place to be able to offer help to Alberta at this time. And one of the things that I've been thinking about, as well as other colleagues in our province, is we may get into a situation where we too need to reach out and look to other provinces for assistance.
And how close are you to that kind of a situation now?
Well, we are activating again, and we announced today that we are going to be able to expand our intensive care unit beds even further. Our teams have been directed. Currently, our baseline staffing is around 80 beds in usual times. They've been directed first to plan to 130, and now they've been asked to plan to 175 beds. Beds mean staff, and so it's not the equipment, it's not the bed. I'm confident we're going to be able to continue to expand, but depending on how the pandemic continues to spread in our province, with increased people getting sick, I'm also worried that we will reach our capacities.
And even the expansion that's underway right now, that comes with a consequence. What is happening to, we use the term elective surgery, but that can often be defined as something that someone isn't going to die of in the next 3 or 4 days.
I agree. But one thing that we've had to do, and we've announced today, is that we're giving direction out to all of our teams that to preserve the ability to care for the most acutely ill, we need to be able to increase capacity by decreasing planned events, planned surgeries, planned procedures. So sadly, our teams are looking at what are the criteria that they will use to determine what will continue starting early next week. Our emphasis is COVID care, cancer-related care, and urgent care that needs to be done in the next 6 weeks. Other than that, I think we have a responsibility, sadly, to focus on saving as many people as we can who are facing acute illness.
Have you done, as some other provinces, Ontario, for instance, had to do in previous waves, and distribute a triage protocol on who you treat if you run out of beds and who you don't treat?
We have. We drafted, created, and shared our protocol. It's called the Critical Care Resource Allocation Framework. Last year, we activated it this spring, and we remain in stage 1, which is usual business, but paying attention to capacity and ability to continue to increase capacity. I have had to share, though, with all staff and physicians yesterday a message out saying, be aware, be thoughtful, and really pay attention to refreshing your familiarity with the framework. We're not at a point yet that we need to move into stage 2, where physicians working with ethicists and second opinions from other colleagues will need to make decisions based on who has the highest likelihood of recovery. We're not there yet, but I do worry that without further decreases in the numbers of people who need intensive care, that we, as in other provinces, we may need to head there.
So you worry about it. I presume you're also seeing projections and looking at what the potential impact of what was just announced yesterday, the requirement to have indoor masking again, the vaccine passport, which in some provinces is the introduction of that has coincided with an uptick in new vaccination rates. What I'm curious about is, how likely is it, how worried are you that you actually will have to implement that kind of a protocol, or do you have some confidence that you're going to see a pullback in these new case numbers and new ICU admissions? If so, what's the timeline for that?
I'm very glad that we have a masking mandate that's in place. We know that's very effective and does decrease quite quickly the ongoing spread of infection. I'm also very grateful that we will have a proof of vaccination mandate across our province as well. However, what I worry about is we've had over 500 cases this week and we're close to that today. Like you said, 476 people infected with COVID, newly diagnosed. Those people could and will continue to get sick and need future hospitalization. And not all of them, but a small proportion of them will. And until we see the case numbers go down or the spread of infection in our communities go down, it's my job to be worried. It'd be irresponsible not to have a framework prepared and to have people thinking about it. I'm not saying that we're going to need it, but we need to be able to plan and think for that. I have hope, though. I hope that and we have seen even today with the announcements made yesterday by the Premier, we have seen an increase in people showing up at vaccine clinics. That's very positive. We also know that it does take time for the vaccines and for your body to have immunity. Mm-hmm. So absolutely, today is a great day to get vaccinated if you have not yet said yes, but you need the time for the second dose and your body to get the immunity.
Can I just ask you very quickly, when you talk about if you go to stage 2, if you essentially have to start making decisions about who gets treatment and who does not because your resources are exhausted, I know that that's a complex decision and would involve a lot of people and consider a lot of factors, including this person's life, who they support, do they have kids, what is their likelihood to be able to continue having a long and healthy life. But does vaccination status play any role in that? In other words, if someone's unvaccinated in the ICU now and is chosen to be unvaccinated, does that have any bearing at all on whether they would get treatment under that kind of a scenario?
No, it doesn't. It doesn't. Vaccination is the best thing you can do so that we never need to see you or look after you. But whether or not you're vaccinated, that does not play into our decision-making in terms of how we will take care of you in any phase of the initiation or the intake into an intensive care unit.
Okay. Dr. Shaw, thank you very much for your time this afternoon. Have as good a weekend as you can. Thank you.
Thank you, David. Stay safe.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.